Hello, everyone. I'm Mark Schurgin, and today I'm going to be talking about the paper, Isolation and Coordination, Challenges of Caregivers in the USA. And specifically today, I'm going to be focusing on informal caregivers, and these are individuals who provide care typically to a loved one in terms of either their health care or assisting them with other day-to-day activities. And as Rosalind Carter put it, there are only four kinds of people in the world: those who have been caregivers, those who are caregivers, those who will be caregivers, and those who will need caregivers. And across the world, caregiver needs are becoming increasingly important. It's estimated that by 2050, there will be over 1.5 billion people over the age of 65, and these people are going to need informal care support. We're already seeing this in the US, where the AARP estimates that there are currently 53 million, or about 1 in 5 adults in America who are providing informal care to an older adult. And this number is even likely higher if we consider informal caregivers for adults of all ages. And so in the current research, we were really interested in understanding across a large swath of caregivers in the US, what are the largest challenges that they face? And so in order to do this, we did a large-scale online survey focusing on challenges with care coordination involving 2,000 respondents, making sure that the sample is going to be representative of the current caregiving demographics in the US. And so to discuss some of the findings, we found that the majority of caregivers, about 6 in 10, identify as coordinating care with at least one other person, not including professionals. So coordinating care with another informal caregiver. And when we ask them how often they do this, it turns out that 72% say that they're coordinating care with another individual at least once a week. And about half, 51%, are saying that they're actually doing this several times a week or more. And so this is a large burden that they're facing, having to coordinate this care with another person in addition to the other caregiving duties that they have. And so in order to understand these care coordination challenges, we asked an open-ended question: well, what are your biggest challenges or difficulties in coordinating care with another person? And so now I'm going to hand it off to my co-author, Lauren Wilcox, who's going to discuss how we analyze this qualitative data and the resulting insights that we found from it.
Thanks, Mark. For the open format question, we met in multiple rounds to generate domain categories and themes through reflexive thematic analysis. And we generated two primary categories of themes: coordination challenges and mediating factors. First, let's dive into coordination challenges. We see three primary challenges. Let's look more closely at the first one, communicating. There were several communication challenges that respondents reported. For example, they mentioned many types of communication breakdowns. They mentioned mistakes based on misunderstandings. For example, we heard from this respondent that the person that they coordinate care with misunderstood my message and told the wrong person the information. We also saw challenges with situational awareness. For example, this respondent reported challenges not knowing what information to talk to other caregivers about. In addition, we see challenges relating to managing and administrating care, including managing the entire caregiving process, as well as specific tasks, and scheduling and temporal alignment challenges. Moving on to mediating factors. These factors regularly interact with one or more coordination challenges and influence the degree of that challenge. The largest group of mediating factors concerns the complexity of relationships that caregivers have. For example, the level of care recipient autonomy was a big mediating factor. This respondent reported that my mother likes to give instructions, she does not like to receive instructions. For example, instructions with medications. We also found mediating factors related to access to resources, and this includes physical and social forms of support, as well as financial and transportation resources. And we also found mediating factors related to both mental and physical barriers. So we pose a number of design considerations and how might we questions in the paper. For example, looking at the second bullet, for technologies that aim to assist people with caregiving tasks, how can we ensure that caregivers and recipients maintain the locus of control and agency that they need? And here, again, looking at the second bullet, we know that informal caregivers face many resource challenges, from financial to their own availability and time to social support. How can we make sure that any technology we introduce would not exacerbate the resource challenges that they already face? Check out our paper to learn more about the informal caregivers we studied, and thank you for listening.